I'm a teacher, and I got COVID back in mid-March, March 15th. My daughter, who goes to the same school where I teach, she actually caught it first. She was 9 at the time, and she had 2 weeks of really bad illness. My daughter and I both made it through the acute infection. We were never hospitalized for the acute infection, so we thought we had made it. And we had a week where we were feeling pretty good, and then these secondary symptoms started to come up. And my daughter was actually hospitalized at Randall's Children's Hospital she had some kidney damage initially from COVID, which has since healed. But she had the long haul symptoms that I had, like tachycardia and resting heart rates of over 140, continued for months, to have weird heart conditions. You've probably heard all of the different symptoms: dizziness and vertigo and joint pain and nerve pain and brain fog and just a constant heavy fatigue.
Michelle is describing what doctors are calling post-COVID syndrome, or COVID long haulers. It's when people's COVID symptoms persist after their initial infection has passed.
Some of those symptoms are extensions of what they had during the acute illness. The unique thing is, though, many of them are non-infectious. We see a lot of people, though, and this is probably the long hauler definition, which is the common term and what we tend to call, post-COVID syndrome. That group is really people who weren't ever hospitalized. So they maybe were younger or even older. They were sick at home, maybe febrile, body aches, felt crummy for, a period of time, but then just never recovered, or they recovered a little bit and then got worse again. Many of them weren't hospitalized, but they have these persistent constellation of symptoms, which, we're seeing now is shortness of breath, chest pain, cardiac abnormalities, what we call a brain fog or cognitive dysfunction. There's a psychiatric component, which is probably both psychosis and depression.
Cindee Maduri is a long hauler who is still having symptoms more than a month after her initial infection.
I'm a registered nurse. I do work at a hospital. 3 kids, healthy lifestyle. I exercise. I like to be active. I like to travel. I eat healthy for the most part. I came down sick on December 3rd. It was really just started as a bad headache and kind of some body aches, and I just, didn't think that much of it. I really didn't think COVID. I thought I had a bad sinus infection, so I reached out to my doctor to get on antibiotics. And just as a precaution, he swabbed me for COVID, the flu, everything. By this time I was feeling pretty bad, and it came back positive. I'm on day 41 right now. All the major symptoms have gone, as far as the bad headache and the body aches, and I had really bad nausea. I couldn't eat. Those are all pretty much resolved, but the issue that I'm having now is that I still have chest pain, which that actually didn't come until about 3 weeks in. I didn't have chest pain initially, and it got pretty intense for a few days. I am a nurse, so I do know how to sort of, assess situations.
Dr. Brittany Bankhead-Kendall, a trauma surgeon and ICU doctor at Texas Tech University Health Science Center, said she's seeing patients with damaged lungs due to COVID-19.
So in the ICU, obviously, we've seen a lot of COVID and the ventilator and everything that you kind of hear about on the news. But as a trauma surgeon, we've kind of seen more and more that people who were just going on about their daily lives and maybe tripped and fell, or maybe had a car accident, they're getting chest x-rays without symptoms of COVID, but knowing that they had a COVID test positive in the past that they didn't think they had problems with. And those chest x-rays are looking bad. They don't look good. They don't look normal. And they're worse than smokers' x-rays a lot of time even. And long term, what does that mean? We don't really know. All we can really go off of is, in the past, people we know of who have had the most similar type of appearance on their chest x-rays were smokers. And the fact that these look worse than smokers could only lead us to think that they could potentially have long-term problems as well.
So I've been struggling with COVID symptoms from beginning of August, October, November, December, and into January. I'm still dealing with the same symptoms, and they haven't really, I don't think they've lessened. I don't want to say depressing, but it is. Just my way of life's changed. I'm not working out anymore, which honestly, as you get older, I mean, that's a big part of, I think, your mental stability, is that you have something to go to every day, and I don't. I mean, I'm actually afraid to go, take a run, because I just don't know how my lungs are going to react. It's difficult to deal with.
Now, many doctors are seeing the need to monitor patients who had COVID who have persistent symptoms. Places like UC Davis's post-COVID clinic are creating treatment plans for long haulers.
We just noticed that a lot of our patients, as you're noticing now, and many people are, had these prolonged symptoms, and we needed a structured way to manage them. And we noticed they were coming largely to see us in pulmonary, but they didn't all have pulmonary problems, right? So they might have a high heart rate and it's predominantly cardiac. It might be predominantly neurologic and a brain fog, but the underlying pathophysiology was the same. And I think that's the thing that's really hard is, will this resolve? If it does, how long will it take to resolve? And, again, this is a new virus. There's so much we're still learning, and I think it's going to be hard to figure out.
This is Inside Edition Digital.